Hello, my name is Christian Alvarado, and my topic is radiation therapy as a treatment method. The cancer I chose is neuroblastoma, which most likely affects children. It attacks the sympathetic system, which is our nervous system, having to do with the brain and the spinal cord. It affects the ability to think, to move, and the lemmas to the sensory system of a child. As it progresses, it starts attacking the lymphatic system, which is our immune system, and other organs within the body. Internal and external radiation are two main types of radiation. External radiation has to do with an external force sending wavelengths to the tumor. And internal force is when a seed-like item is placed within the body, and from there it sends wavelengths to the organ. Now, although both are good uses of treatment, external radiation is more beneficial and useful because it can be used at any stage of neuroblastoma. For my first subtopic, I would like to compare surgery and radiation therapy. Now, surgery has to do with completely taking out the tumor from the body. With this come high percentages of patients with long-term survival seen through my research. Now, there's also research that shows that radiation therapy and surgery used together brings more benefits. Now, radiation therapy can also stand alone. Radiation therapy is actually better in the sense that if any complications occur, it can be easily fixed, unlike surgery. So overall, external radiation is better than surgery because it can be used at any stage of neuroblastoma. The amount of radiation can be adjusted depending on the advancement of the tumor, unlike surgery that just takes it out at once. So if the tumor has progressed a lot, then the amount of radiation increases, and if it is barely in stage 1, then only a little amount of radiation is exposed to the patient. For my second subtopic, I compare internal and external radiation. Now, for external radiation, we already went over that the amount of radiation can be adjusted based on the stage of neuroblastoma. Also, external radiation can potentially be a cure if a high dosage of radiation is exposed to the patient. However, this is very dangerous because healthy cells can also be damaged, and we don't want that. Also, a downfall is that for children, it has been seen that if radiation is exposed to their back, then their growth is affected by it. Now, for an internal radiation, there's little known about it yet because it has only been exposed to doctors for about 40 years. But it's been shown that a higher percentage compared to external radiation, internal radiation can eradicate tumors. Now, the reason for this is because it is coming from within, the wavelengths sent to the tumor can absorb it, unlike external radiation that is a more general area. Now, the only problem with this is that healthy cells can be completely eradicated as well because it is near to the object releasing the wavelengths. So to conclude, comparing surgery and radiation therapy, they both have circumstances in which one is better than the other. However, overall, radiation therapy is it's better because it can be adjusted at any point of stage of neuroblastoma. Also, if any problems occur, it can be easily adjusted because of the radiation, and it is more difficult to adjust if it is with surgery. Now, internal and external are both great because they can both potentially eradicate the tumor. However, because there's little more known about external radiation than internal radiation, it is safer to go with external radiation for the safety of the patient. So therefore, external radiation overall is much more better than internal radiation and surgery. Thank you for your time.